Thank you, Ángeles, for being here today. Thank you for being in the conference sponsored by Berenguer. And here in the Mobile Congress 4 years from now, you are you are the lead of the public affairs of IT Health. Explain a little bit what is IT Health for still few ones that do not know what IT Health is.
Okay, EIT Health is the knowledge and innovation community for health that was created by the EIT, the European Institute of Technology and Innovation. There is a body from the European Commission created within
Yeah.
Horizon 2020 in 2015. So EIT Health, which is one of these kicks, as we call them, what we want is to boost innovation in health within Europe, and not only for the sake of the health of the patients, but also for the sustainability of the healthcare systems across Europe, and also for the sake of the success of the especially startups and SMEs, and for a better health economy in our regions. So what we do is initiate programs in what we call the triangle of knowledge. It is programs in education, innovation, and acceleration. These programs are funded by the European Commission and also co-funded by our partners. There are more than 100 partners across Europe from the different agents of the whole value chain in health innovation. About acceleration and about our support to startups, what we try is to support them in the whole process from the idea to the internationalization of the startup. So providing them support in terms of educational programs, in terms of innovation programs, but also supporting them in terms of mentoring, coaching, creating generating knowledge, creating the appropriate connection to other members of the innovation ecosystem. So many of the startups in Spain has gone through some of our projects, and some of them really successful now in the internationalization stage of the
Ángeles, you are always quick, no, to see a necessity, no. And last week you launched a new initiative, no, to help on the delivery, on the implementation, on the assessment, validation of digital health.
Okay.
Can you explain a little bit why the necessity and what do you expect from that?
What we are seeing is that there is a huge diversity and fragmentation of the processes for evaluation, adoption, implementation, or reimbursement or funding of digital health application or digital health solutions, okay, in a broad sense within Europe. So after COVID-19, there has been different initiatives. The most important one, because of it was first experiment, was the so-called Diga Fast Track in Germany that tried to generate a more agile introduction of digital applications within the care pathway, the conventional care pathway, and within the reimbursement, let's say, methods within the country. And other countries have gone through similar processes like France and Belgium or Estonia. But in Spain, we are lacking a process like that, and we are lacking also an harmonization of all these processes in order not to fragment the innovation processes even more. Otherwise, the startups wouldn't benefit from this moment, this incredible moment with all that funding from Europe, with all those strategies from a national and European perspective. And this project that we have called in Spain a framework for a fast track of digital health solutions, or F3T. It's a project that brings to the table agents from public and private organizations of the whole value chain in health innovation in Spain, in order to understand what is the current process of evaluation, adoption, implementation, financing of this kind of solutions, understand what are the bottlenecks and pain points within that process for all the relevant agents in that process, and also try to find together in a collaborative way what are the quick wins or solutions that can be quickly implemented in a short term or medium term, okay? And the good thing of this project is that there is a consensus from all the people in the table, and this is 3 health systems, 2 health technology assessment agencies, industry, like AstraZeneca, for example, and also DKV, Telefonica, you know. So there is a huge consensus around this need for fast adoption of digital health.
Do you think, Ángeles, that this fast track could be merged with potential new initiative in the paying for value, no, as a value outputs, no? Because at the end of the day, the issue is always about what is the payment process. We know that we want to convince governments to pay for value care, no? Is it possible to intertwine both initiatives? Because sometimes there, at least in National Health Service in UK, there's some pilots where it's given to a certain company, like a bidding process where we want to reduce cardiovascular risk or mortality by that. You can use pills, you can use apps, you can use behavioral change all together. Do you see, or is it still too early to mix all these initiatives?
No. In fact, this initiative has different building blocks, and one of them is how to finance this and who is going to pay for that. Okay. So we are going also to address this issue within, and especially important in Spain, with 17 different health systems that at the end are those who has to pay for the services, okay? No matter if the application is part of the portfolio of services, the common portfolio of services at the national level, then it has to be paid, and it has to be implemented and adopted in the regional community. So we want also regional governments and regional health systems to understand the process and to co-create potential solutions that help startups, that help developers to, let's say, to have a sustainable business in such a rich market as the public-funded health systems in Spain.
No, thank you, Ángeles, for, I think the work of IT Health here is essential. No? Very few organizations with this transversality, a huge amount of partners, no, that are in a neutral way linked to all of you. And we hope that you can really convince, no, the decision makers to move forward in that sense. No? We are in the final quick question. We are in the Planet Health podcast. No, you as IT Health, you know, you are promoting the access to different funds, to acceleration programs, to startups. No, this need, as I commented in my inspirational talk, the need of startups that are targeting essential problems, no, for human health, for sustainability. How do you see the capacity of institutions like you, governments, to help these startups that are essential, but sometimes are difficult to traction at the beginning?
Yeah, well, in EIT, there are different kicks, okay, within EIT. Okay. So we are different communities of knowledge and innovation working to support the startups in different areas, and health is one of them, but also manufacturing, climate, digital, food. So I think that all the power that the EIT kicks can bring to innovation in this difficult issue or difficult area like planetary health, I think that could be key agents for providing support to startups, but also looking for those needs and those potential solutions in a collaborative way. So I think that the point of planetary health is completely relevant for today, for today's health and today's planet sustainability. So we will try to do our best.
No, it's amazing. You have 4 kicks, like food, climate, digital, and health, that can contribute to that. No? So amazing.
Yeah.
Thank you, Ángeles, for being in Planet Health podcast, and we wish you the best on these difficult times. But thank you for helping all the startups, governments, and so on. Thank you very much.
Thank you very much, Jordi.